Did you know you could be taking your blood pressure medication perfectly every single day and it still might not be working? Here's why. When you take ibuprofen or naproxen regularly, even just on weekends, these medications tell your kidneys to hold onto sodium and water. That extra fluid raises your blood volume, and higher blood volume means higher blood pressure. It's a direct physical effect, not a fluke. Here's where it gets tricky. If you're already on a blood pressure medication, that sodium and water retention can work against it. Your doctor's prescription is doing its job, but the ibuprofen is quietly undoing it at the same time. The real problem is that almost nobody mentions over-the-counter pain relievers to their doctor or pharmacist. They don't seem like real medications, but to your kidneys, they absolutely are. If you take blood pressure medication and you're also reaching for ibuprofen or naproxen more than a couple times a week, bring that up at your next appointment. That one conversation could change everything. I'm a licensed pharmacist. This is education, not a substitute for your own provider. Did you know that most standard drug doses were never actually tested on women? Here's why that matters more than you think. For decades, women were largely excluded from clinical drug trials. So the doses we still use today were built around one body type, a male one. And this isn't just a history lesson. It shows up in real life, right now. Women tend to have lower body water content, different fat distribution, and slower clearance rates for certain medications. That means the same dose can hit differently, stay in the body longer, and build up to higher concentrations than intended. The result? Women report adverse drug reactions at nearly twice the rate of men, not because they're more sensitive, because the dose was never calibrated for them in the first place. So if a medication has ever felt too strong or the side effects seemed worse than expected, that experience is not random. It's pharmacology. Talk to your pharmacist or doctor about whether your current doses still make sense for your body. That conversation is always worth having. Did you know a supplement you take for your hair could make a doctor think you're having a heart attack? Or the opposite, hide that you actually are? Here's what's happening. Biotin is everywhere right now. Social media pushes it hard for hair, skin, and nails. And the doses in most of those supplements are thousands of times higher than what your body actually needs. At those concentrations, biotin interferes with a specific type of lab testing technology used in some of the most important blood tests your doctor orders, thyroid panels, and cardiac troponin, which is the key lab marker used to diagnose heart attacks. The FDA has put out safety communications on this exact issue. The scary part is the gap. Someone takes biotin every morning, never thinks to mention it, and a lab result comes back wrong. The doctor makes a decision based on that number and never knows why it was off. So if you take biotin, tell every healthcare provider before any blood work. It sounds small. It really isn't.